Today we're going to review the pre-anesthesia testing guidelines and give you some guidance to help clarify the process. Step 1 is when the surgeon makes a decision that the patient needs to be scheduled for surgery. So where do we go from there? Once the nurse knows the type of procedure that's going to be done, they'll look at the surgical risk stratification table and see if the procedure is low, intermediate, or high risk. Remember, for this one, we're talking about the risk of the procedure only. We're not yet talking about the patient or taking the patient into account. Let's say our patient's going to have an EGD or a colonoscopy. When we look at the surgery, EGD colonoscopy falls into the low risk category right here. Now that we know our procedure is low risk, we go over to the preoperative testing grid. We see that procedures like this, there's no routine testing indicated. We're looking right here for that. But you see the second part, it's indicated by patient compliance or acute changes in status. We're going to revisit that as we move along for this patient. But let's say this patient's a 40-year-old female who has CAD and had a heart stent a couple years ago. Unless she's had a hysterectomy, she automatically gets a HCG. So here's where the patient history plays into what the patient needs. If since the patient's heart stent, they've had no problems, we don't need any testing for a low-risk procedure. If the patient says they've been great since their heart stent, we do nothing. If the patient says, well, I was mowing my grass a few months ago and I had a little chest pain, or I get a little short of breath going upstairs, then we should order an EKG to make sure nothing new is going on because of that cardiac history. Another thing we need to look at for this patient is the PKIMC outpatient procedure preoperative protocol that you guys are using in the clinic. If the patient is morbidly obese, having chest pain, has been a difficult airway, or some of the other things listed in this sheet, please feel free to contact anesthesia with any questions. I'm just going to sort of scroll this sheet so you can see some of the things. And you have this paper in the clinic to review. So let's get back to this patient. We've ordered an EKG on her because she's had an acute change in her status after her heart stent. The EKG comes back and the nurse compares it to her last EKG and it shows a new left bundle branch block. This is where we consult this abnormal test results sheet. We're going to scroll down. EKGs. And we see, let's see, go a little bit further. So that first one we were looking at right here, these are things that we aren't going to worry about on an EKG. The next one here is here, and we see that new left bundle branch block is there. That didn't quite work like we wanted to, did it? So we see here, we got that new left bundle branch block. So what are we going to do with that? You look to the box to the right, and it says we need to compare to the prior EKGs, and you just follow those instructions there. But basically, we're going to let the surgeon know what we found, and we look at the box, and it says exactly what to do. Now, if we got our EKG back, and it showed nothing new, or when we compared it to the old EKG, that left bundle branch block was already there, then we would have done nothing because there's been no change. So on this example, our colonoscopy patient is good to go and go ahead and be scheduled from a pre-anesthesia testing standpoint. All right, let's run through one more patient for good measure. Let's say the same patient is going to have a lap chole. We see that lap chole on our previous grid, our surgical risk stratification table, is an intermediate risk. So with her heart history, We want to see an EKG within 3 months, a CBC within a month, and a BMP within 3 months. And if anything comes back normal on those, we want to again consult that abnormal testing grid. And where I'm seeing here is we've got, she would most likely, unless she had a hysterectomy, be a menstruating female, and she's got heart disease. So this is what we want to do. And here are the ages of those acceptable studies. So that's what we're looking at. That's it. If there's any questions that arise or you want to ask anesthesia any question, just see who is on call for the day and give them a shout. We would all be happy to help you.